Good day, ladies and gentlemen. My name is Agatha Ellen. Good day, ladies and gentlemen. My name is Agatha Ellen Wapmok. I am a public health physician and a research fellow at the Nigerian Institute of Medical Research, Yaba, Lagos, Nigeria. The Nigerian Institute of Medical Research is the foremost medical research institute in Nigeria, which has the mandate of conducting research into diseases and conditions of public health importance and promptly reporting those findings to relevant stakeholders, whereby decisions could translate into policies that will improve health outcomes. I am a participant of the Policy Advocacy on Genetic and Genomics course 2026. I belong to group number 3 together with Aline Peter, and we are the opposing team which stands against the team saying should African countries establish national forensic DNA databases to support criminal investigations and public safety. By way of introduction, forensic DNA databases are important tools for criminal investigations and public safety. However, before establishing a national forensic DNA databases, there needs to be some structures on ground, such as strong legal frameworks, robust data protection, adequate funding, and reliable forensic infrastructure. These things are necessary for an effective national forensic DNA database. And looking at the current challenges faced by many African countries, our team strongly disagrees with the establishment of a national forensic DNA database in Africa due to privacy violations, misuse of genetic information, weak governance, and high cost. All these things outweigh the potential benefits of this establishment. Therefore, we oppose the establishment of national forensic DNA databases at this time in Africa. The Honorable Chairperson, distinguished judges, and esteemed colleagues, we oppose the establishment of national forensic DNA database in Africa. Imagine the future of Africa, whereby every individual's genetic information is stored in a government vault. This becomes very accessible to anybody. It makes us vulnerable and has the potential to be misused by anybody, by the government or miscreants. Yes, we know that forensic DNA technology is valuable. However, we believe that the current legal, ethical, financial, infrastructural challenges faced in Africa make this establishment of this forensic database premature and potentially harmful to the citizens of Africa. And why do we say that? Why do we oppose the establishment of the national forensic database in Africa? It violates privacy and human rights. DNA contains highly sensitive genetic information of individuals, not just only fingerprints information. It also contains the blueprint of our humanity. Predisposition to diseases are also contained in DNA information, and therefore when it gets to the wrong hands, such as miscreants or certain government functionaries, it can lead to exploitation. It could lead such governments to control people instead of providing safety for the citizens. And there are also weak data protection laws and cybersecurity systems in many African countries. This increases the risk of misuse, unauthorized access by miscreants, and government could use it to discriminate certain political opponents, and the government has access to all this information, which is detrimental to the citizens of Africa. It's known that Africa has weak legal and institutional frameworks. They lack comprehensive legislation that governs DNA collection, storage, sharing, and destruction. And so without an effective legislation that governs DNA collection, storage, sharing, and destruction, many things are bound to go wrong with the processes, and therefore we will need comprehensive legislation that governs DNA processing in Africa before establishing a national forensic DNA database in Africa. There also needs to be an establishment of independent oversight, because without this independent oversight, information about innocent citizens will remain in databases indefinitely and could be used in the future against them. There are also possibilities of wrongful convictions. We all know that DNA evidence is not totally error-free. There could be contamination while collecting the samples. There could be mislabeling. The chain of custody could be faulty. There could be poor storage conditions poor storage conditions due to lack of constant electricity. There could be inconsistent processing conditions and laboratory mistakes. And when any of this is present, there could be mistakes and will lead to wrongful convictions of innocent citizens, and they would, especially in the systems where the judicial system is trained already. There's an increased risk of misuse and political abuse when there's a national forensic DNA database. This happens when there is poor crime scene management. A lot of people are not aware of what to do when at crime scenes. Some people want to help, but when they come to those scenes, they tamper with things that they're not supposed to touch, and so when samples are taken, they could be tagged as the criminals, and there will be wrongful convictions. And we would not forget dealing with corruption in Africa. There is also corruption in Africa. We also have inadequate forensic laboratories and limited training. This should be addressed before creating any national DNA forensic database in Africa. There are basic things that are required for creating a national forensic DNA database in Africa. It could also be exploited for political persecution. Authoritarian governments could use it against political opponents. It could be used for ethnic profiling or unlawful surveillance, especially where governance and accountability are weak. We know that many African countries face shortages of accredited forensic laboratories and trained personnel. In Nigeria, we have what we call the JAPA syndrome. The JAPA syndrome is where most medical personnel migrate to other countries, especially the European countries, where they feel their services are more appreciated, and it could translate to improved livelihood. And so there is a dearth of trained personnel in Africa in genetic and genomic studies. The role of the financial commitments in establishing a national DNA database cannot be oversized. It requires expensive laboratories, sequencing equipment, secure servers, trained personnel. There has to be an accreditation, which is quite expensive, and it requires constant power supply. And certain countries in Africa are known to have erratic power supply, and so this does not support establishment of a national DNA database. And it also requires long-term maintenance, and all this accrue lots of cost. And we know that African countries face competing demands for their available scarce resources, and so therefore, instead of diverting funds to establish expensive national forensic DNA database, these funds could be used to improve the healthcare, improve education, and provide social infrastructure which will improve the livelihood of the common man in Africa. It's also observed that there is a poor sustainability culture in African settings. Therefore, investments should focus on strengthening basic necessities such as community policing, strengthening the judicial system, and community-based safety measures rather than forensic databases, which is known to be expensive. There is a heightened mistrust between the government and the governed, and this was displayed during the COVID-19 pandemic and the rollout of the HPV vaccine in Africa. There were accusations by different ethnic and religious groups accusing the government of trying to alter their genetic makeup through administration of these vaccines. And so when the government now talks about establishing a national forensic DNA database, this will escalate the mistrust. There will be heightened suspicion, and it will affect acceptability and utilization of other beneficial health interventions. So we recommend that the government should prioritize addressing myths and misconceptions surrounding health interventions, and this will help them to win the trust of the common man before they can talk of introducing or establishing a national forensic DNA database. The proponents claim that national forensic DNA databases improve criminal investigations. Yes, it can assist in investigations, but it's not the only way to achieve this. In Africa, we lack accredited forensic laboratories, we lack trained personnel and quality assurance systems, and without this in place, DNA evidence may be contaminated, misinterpreted, or delayed, and therefore strengthening existing forensic services should come first before establishing expensive national databases. Our proponents also claim that databases reduce wrongful convictions. It's not immune to DNA evidence is not immune to error. There could be contamination, there could be sample mix-up, human error, and this will lead to wrongful convictions whereby innocent people are convicted of crimes they have not committed. And if the criminal justice judicial system in such countries lack transparency and accountability, then the DNA evidence can also be misused. And so therefore, a database cannot fix broader weaknesses in the policing or judicial system. So therefore, we are against this claim. Proponents also claim that DNA database help identify missing persons and disaster victims. We argue that identifying missing persons does not actually require a permanent national DNA database. The samples can actually be collected from victims and relatives when needed, and it will help in identifying the missing persons when there are conflicts or natural disasters. So we advocate for temporary reference databases because this can achieve this without permanently storing citizens' genetic information. Our proponents also claim that DNA databases strengthen public safety by identifying repeat offenders. There is actually limited evidence that says that expanding DNA database alone reduces crime. Prevention is actually better than cure. Establishing national forensic DNA database is reactive rather than being proactive. We need to strengthen public safety. Actually depends more on effective policing, intelligence gathering, community policing, and efficient judicial system. And so therefore, scarce resources should be better invested in these priorities, which will go a long way in providing public safety and also prevent crimes. Our proponents claim that DNA database support regional cooperation against cross-border crime. We negate this statement by stating that cross-border DNA sharing raises lots of concerns because it infringes on privacy. There are issues of cyber security, and then there could be misuse of genetic data that has been shared with these countries without knowing their true intentions of establishing this cross-border DNA sharing policy. And we know that many African countries lack robust data protection laws and secure infrastructure, which makes us vulnerable to the targets of more developed countries when we engage in cross-border DNA sharing. I would like to close by stating that forensic DNA technology, yes, has undeniable value in criminal investigations. It could sound modern, it could sound efficient. However, establishing a national forensic DNA database in many African countries seems premature, this time when Africa is faced with lots of basic challenges such as hunger, poverty, poor accessibility to healthcare, and educational gaps. And so, until we have basic things on ground, such as strong legal protection, adequate funding, reliable forensic infrastructure, adequately trained personnel, and independent oversight, until we have all this in place, the risk of privacy violations, misuse, and injustice will definitely outweigh the potential benefits of establishing a national forensic DNA database in Africa. Thank you very much for listening. These are my references, and we'll take any question from here. Thank you very much.